So that's me. When I was about 2 years old, my name is Dr. Hania Bednarski, and I was born in Poland. This picture was taken in Poland, and I moved to the U.S. with my parents when I was 8 years old. Since I was very, very little, I knew I wanted to be a surgeon. In fact, that's one of my first patients. Actually, she is my first patient. She's still with me. This photo was taken just yesterday. So as a child, I would perform very, very innovative and successful surgeries on this koala. She was always fully cured. She may have lost a few nails in the process, but... So I did realize my dream, and I became a surgeon. I went to medical school in Kansas City, and then I did my general surgery residency in New York City. And I initially finished a hand and reconstructive fellowship in the South Bronx. So I stayed in New York. And I worked in New York as a hand surgeon for over 3 years. I really enjoyed that, and it was fulfilling, but my passion to help women really prevailed. And I knew that that was truly my first passion, and I went back and I did another fellowship in breast oncoplastic surgery, and that was also in New York. And I am incredibly fortunate as a physician. I've been practicing for over 19 years. I've focused exclusively in breast care for over 11 years. And I live by a very simple principle, and that's patients first. My patients are everything to me. And they all have my home phone number, my cell phone number. They all know that they can reach me anytime, day or night. And I truly live by that principle. And I have so far been able to care for patients in quite a large area of the Midwest. And I've cared for over 2,000 patients so far by myself. So do you know where we are on this map? Let me help you. So that blue circle is here, St. Louis, and the green circle is Maryville. That's where my practice is. And so a few years ago, we did this little exercise. Oh, hold on. I'm going to zoom out. Hold on. First, I want to zoom out. We're going to zoom out a little bit. So this is kind of the southern Illinois and Metro St. Louis area. So a few years ago, we did this exercise where we actually mapped out all the different zip codes that I have seen patients from. And this is what we came up with. And actually, this map is now much larger. I have seen patients in Springfield, Illinois. I've also seen patients in Springfield, Missouri. And so patients have driven more than 4 hours to see me, which I think is really incredible. It makes me feel so incredibly fortunate to be able to take care of those patients that they have chosen me to be their doctor. So why do patients travel so far to see me? What do I do that's a little different? Well, I provide truly comprehensive breast care to patients of all ages, men and women. I treat benign and malignant breast problems. I perform everything from biopsy through reconstruction. And I can also help a patient anywhere along the path. So if they've had surgery with somebody else, I can pick up and continue. It doesn't matter. I can help anyone at any point during their journey. I also perform cryoablation, which is the freezing of tumors without surgery for benign or malignant causes. And that is something that nobody else in the St. Louis area does. It's something that nobody in Chicago does, nobody in Kansas City does. There used to be somebody in Detroit, but not any longer, so I am truly it for this area. I also do breast reconstructions. I do breast reductions, lifts, and revisions of cosmetic surgery that just didn't go right. And if a patient has breast cancer, I hold their hand throughout their entire journey. I actually take the place of 3 physicians: a surgeon, a radiologist, and a reconstructive surgeon. And I am all boobies all the time. That's what I do. So in fact, if you actually go online and type in allboobiesallthetime.com into the URL, you will come to our website.